my name is Nurfazlina. I'm from Group D3. I would like to explain to you about total hip replacement. Total hip replacement surgery is an effective treatment for worn out or injured hip joints with a success rate of 19%. Most patients retain their prosthesis within 15 to 20 years or even a lifetime. However, a small percentage require revision surgery within 5 years due to implant failure. So, our main for this video is to understanding with you guys the causes of these failures and exploring biomaterial strategy to extend implant lifespan. First of all, we want to explain few factors, example, infection, dislocation, and others that we'll explain by my other friends. Second is about few biomaterials to prevent from failure such as stem, cup, and more elaboration soon. Third, device for total hip replacement, the design and the biological evaluations. So, stay tuned to watch our explanations with you guys.
Next is factors that contributing to the failure of total hip replacement. First is infection. Periphostatic joint infection (PJI) is around the prosthetic joint can lead to significant complications, often necessitating revision surgery. Bacteria can form biofilms on the implant surfaces, making eradication difficult. Second is failure due to wear and tear. The prosthetic components can generate wear particles that induce inflammation and osteolysis, leading to loosening of the implant. Third is dislocation. Dislocation occurs when the forces on the implant head, mainly caused by impingement, overcome the soft tissue resistance or tension, helping to prevent excessive travel of the head. Fourth is loose prosthesis. The main mechanism for loosening is thought to be wear particles from the prosthesis itself, which in turn triggers an inflammatory reaction. And lastly is patient factors, which is first activity level, second is age. Patients who are younger and more active patients put greater stress on the implant, increasing the risk of wear and loosening. And third is obesity.
Okay, 3 biomaterial approaches to prevent total hip replacement from failure. Okay, for the part of the stem is titanium alloy. We know titanium alloy has an excellent corrosion resistant, highly reactive material, and lowest rate dissolution. Porous metal like titanium alloy are used to improve osseointegration, which is a direct structural and functional connection between living bones and the surface of the load-bearing artificial implants. This approach aims to provide a better bone-implant contact and reducing the risk of the implant loosening. Okay, for the second one is head. The suitable biomaterial approaches is the alumina because it has a high resistance, wear resistant, reasonable fracture toughness, and extremely stable. Ceramic material like alumina offer excellent wear resistance and reduce the generation of wear particles. Ceramic on ceramic bearings are considered for younger and more active patients due to their durability and the minimal production of debris. Okay, for the last one is the cup of the hip replacement. The biomaterial approaches is WHM-WPE, as known as polyethylene. The use of highly cross-linked polyethylene has been shown to reduce the wear and tear of the implant significantly. This material is more resistant to generation of the wear particles, which can lead to the osteolysis and aseptic loosening of the prosthesis. It has known as a tough inert. Thank you.
Next, I will continue with the third question. Biological evaluation of total hip joint replacement based on ISO 10993. From the table ISO 10993, medical device categorization consists of nature of body contact and contact duration. Hip joint replacement are in a category implant medical device and in contact with tissues or bone. Medical implants are device or tissue that are placed inside or on the surface of the body. The contact duration of the device is a long-term duration which is more than 30 days. After that, the evaluation of biological testing related to hip joint replacement comprises of 11 tests. Firstly, cytotoxicity testing to ensure that the material used do not release harmful substances that can damage surrounding cells. Secondly, sensitization testing. Evaluate the potential of the material to cause allergic reaction. Thirdly, irritation or intracutaneous reactivity assesses the potential for the material to cause local irritation when it contact with tissues. Next, acute systemic toxicity determines if any leachable substances from the implant can cause systemic toxic effect. Next, material-mediated pyrogenicity, subacute toxicity, subchronic toxicity, chronic toxicity, implantation effect, genotoxicity, and lastly, carcinogenicity.
Hi, my name is Muhammad Hazim bin Abdul Razak. My metric number is 2211523225. Today I'm going to present about new total hip replacement. As a junior biomedical engineer, we are excited to propose the main components and design consideration for new total hip replacement. Here's comprehensive outline. For the main component of parts, we have femoral component. First, a stem, a cylindrical or tapered rod that anchors into the femur. It is like bone. Then we have neck, connects the stem to the ball head. Lastly, ball head, a spherical component that articulates with acetabula cup. Then we have acetabula component. We have cup, a hemispherical or spherical component that articulates with the ball head. Then we have liner, a thin wear-resistant layer that lines the cup. And lastly, pelvic component, which is acetabula shell, a metal or ceramic component that anchors into the pelvis. Now for the design consideration. First, we have chemical properties. The biocompatibility. The biomaterial used should be non-toxic, non-inflammatory, and non-carcinogenic to ensure compatibility with human body. Next, we have corrosion resistant. The materials should resist corrosion and degradation in the presence of bodily fluids. Next, we have osteoconductivity. The biomaterials should be promote bone growth and integration. Second properties is morphological properties. First, we have surface topography. The surface texture and roughness should facilitate bone growth and integration. Next, we have pore size and distribution. The biomaterial should have a controlled pore size and distribution to promote tissue ingrowth and vascularization. Next, we have geometry and shape. The components should be designed to mimic the natural anatomy of the hip joint. The last property is mechanical properties. We have strength and stiffness. The biomaterial should possess sufficient strength and stiffness to withstand the mechanical loads and stress of the hip joint. Next, we have fatigue resistant. The material should resist fatigue and fracture under cyclic loading conditions. Lastly, we have wear resistant. The articulating surface should be designed to minimize wear and tear, reducing the risk of osteolysis and implant failure. Now for the biomaterial selection. We have cobalt chromium alloy. The advantage is high strength and wear resistant, more durable and can withstand greater forces, potentially lasting longer. Next, it's proven track record, widely used with a long history of successful outcome. Then we have titanium alloy. It is excellent biocompatibility, less likely to cause allergic reaction or tissue reaction. Then it is lower stiffness, closer to natural bone stiffness, potentially reducing stress on surrounding bone. Next, it is lighter weight, may improve patient comfort. Lastly, osseointegration. Surface treatment can promote bone ingrowth for better long-term stability. That's all from me. Thank you.
To sum up all of the content, the materials chosen for total hip replacement significantly affect the surgery success. Advanced biomaterials and coatings have improved implant longevity and functionality. ISO 10993-1 effectiveness of this device through biological evaluations. Biomedical engineers optimize patients' outcome and minimize implant failure risk by carefully assessing the chemical, morphological, and mechanical properties of materials used developing new hip replacements. That's all from us. Thank you.